I've been in practice for 31. I was a chiropractor to start out with. I went back to my neurology specialty, and then I've had that since '95. And the thing is, there's many things that we can do, applications to make your brain work better, and sometimes it's not even chiropractic, but it's a lot of physically based things. And so that's my practice, but the thing is, there's many things you can do to complement it, and that's with nutrition and supplements. And I'm not here to sell you supplements tonight. I'm going to tell you the benefits of certain things to do. And the neat thing about Celine is she's got a background in, as far as cooking, it's like, okay, there's a lot of foods you can do to make yourself healthier as well. So I'm totally on the same page with that. So I'm just going to do a general overview. Does everybody know what serotonin and dopamine are? Okay, everybody pretty much does. So I'm going to start my slide out with, we're going to talk about serotonin. And serotonin is actually, everything should be balanced, and if it's not, you're going to have problems. So if you don't have enough serotonin in your brain, you're probably going to be bipolar depressed. If you got too little dopamine in your brain, you're probably going to have a movement disorder like Parkinson's. And if you got too much dopamine in your brain, you're probably going to be dealing with something like schizophrenia. And the reason people a lot of times have too much dopamine in their brain is because they're doing the wrong things. Alcohol, drugs, cocaine, those are all things that are going to basically stimulate your dopamine receptors and then eventually fry them out, and then it's going to give you the problem. But anyway, the way serotonin works is, anybody know what tryptophan is? No? Okay. Well, tryptophan is an amino acid that basically, it's found, we're about a month or so away from Thanksgiving, so when you eat turkey, poultry, there's a lot of tryptophan in it. And so what happens is that's what calms your brain down. Serotonin is more of a relaxer. Dopamine is a little more of a stimulant. And now it goes back to supplements. And back in 1989, there was a Japanese company that was producing L-tryptophan. And they ended up killing probably about 100 people because they had bad product. And it wasn't the tryptophan, but it was basically a bacteria that caused it's called eosinophilia, and it's basically one of your 5 white blood cells that basically killed several hundred people across the world. So that was in 1989, and it was outlawed until 2004. Okay, so a lot of times too, you can say, well, and I love Costco for a lot of things, but their vitamins is junk. And a lot of times too, you get what you pay for when you buy a supplement. And one of the things I like about this, if I can have that one there, is one of the things I love about Zymogen is you cannot buy this stuff. It's only through a physician, and actually every product has a barcode on it. And you see, the problem is, I love Amazon too, and the problem is, a lot of times you can buy different other popular name brands are, Progressive, Pure Encapsulated, Thorne. What they'll do is a third-party buyer will buy up expired lots, take the vitamins, or the bottles, or a lot of times even put a placebo in, or put expired vitamins in, and then sell it back to the public. And people try to save money where they can, and you really get what you pay for. And that was just a perfect example of that Japanese company had poor quality stuff and they killed people. Okay. But anyway, getting back to serotonin, tryptophan is what makes it. And you will, you need to, I'm going to talk about different supplements. There's different supplements that are good for certain people, and I'm going to talk to you about blood work in the end here. So anyway, my next slide is now dopamine. And dopamine is, everything kind of starts out just like turkey is a protein, you break it down, it's amino acid. So tyrosine is basically the amino acid that helps create dopamine. And it also creates something else called epinephrine or norepinephrine. And it has more of a mental alertness and a stimulating effect. And there's different foods that you can eat that will help produce this as well. There's you can get some of this stuff from eggs. You can get a lot of your best fruits are blueberries. Okay, and a lot of times too, your best when you look at fish for the most part is good, and your best nuts are probably almonds, sesame seed, or pumpkin seeds, where you can get this stuff as well. Just the big question is, are you getting enough of it that it's going to be metabolized into your brain to make the changes chemically? Okay, and the problem is, I grew up in a dairy farm in rural Minnesota, and true organic has been gone for 40 years. Okay, because back in the farm, we would corn or soybeans one season, the next season would have oats or soy or alfalfa. He'd replenish the soil. And now with corporate American farming, it's that same field, it gets the same corn on it every year. And between Monsanto and GMOs changing stuff, we don't have the same foods like we had anymore. So, but anyway, dopamine is created from tyrosine. And the next thing I'm going to talk about is melatonin. And that's a neurohormone that, once again, interacts, helping create these other chemicals. And melatonin has an effect of just calming and relaxing you. So, there's different things you can take that everything you show balance in your body. So, okay, now a lot of people, has anybody heard about leaky gut? Okay, and really, it's not so much a leaky gut. In fact, it's just an inflamed gut, and a lot of things happen in the brain that are all related back to your digestive tract. And what I see a lot clinically is if people suffer a concussion or a whiplash, their brain doesn't work. And then when their brain doesn't work, their gut doesn't work. And then when their gut doesn't work, it becomes this juggernaut back, because a lot of the receptors in your gut help to produce serotonin. So that's where a lot of times you can't just treat somebody physically, you need to try to treat them nutritionally as well, otherwise you just fry the receptors in the whole system, okay? And there's different types of omegas out there. Your most common is, and this is the thing, I just had a hip surgery, and what do they always tell you to do right before you have surgery? It's like, stop taking all your supplements, okay? Keep taking your drugs, but stop your supplements. So if you, we all know that krill or salmon is probably your best sources of a good omega-3. You got to have your omega-3, 6s and 9s. You got to have a nice ratio of them all. And the thing is, salmon is good for omega-3s, okay? So if you see Mark having a salmon salad, you'll go, wow, Mark's healthy. He's having salmon, he's having salad. But what if Mark hates salmon? I hate salmon, okay? So I take it in omegas. So I didn't change my supplements at all up until my surgery. And it was kind of funny when my doctor came in that afternoon. I had surgery first thing Wednesday morning. He came in the afternoon. He goes, well, you have really strong bones for your age, and there's very minimal blood loss. So I just kind of sat there and laughed. I was going to insult him on that. But the thing is, there's different types of omegas you can get out there. The one thing I like about the Omega Monopure is, has anybody had the gallbladder out here? Okay. The problem is when you have your gallbladder out, you've lost the ability to digest fats, okay? And the problem is too, if let's say you've already suffered any kind of spinal injuries ever, as far as whiplashes, this stuff comes back to haunt us years later. If you start developing problems with your gut that you got to start taking Prilosec, or you have GI symptoms, your ability to digest a fat-based omega-3 gets really bad. And the nice thing about this product here, it's a term called micellized, and what it means is they have the technology that they take the fat, they convert it into a water soluble, so that way it's absorbed. And the price of the supplement compared to the stuff that I used to carry in my office is not that much different. And the actual nice thing is it's 3 times more absorbed, so you have to take less supplement in order to get the same effect. And the big thing is, and I'll be talking at the end here, blood work doesn't lie. And there's different tests you can measure your inflammatory markers. And if your inflammatory markers are bad, you're going to tell you some things to take. And if you retest and if it made a difference, then you're on the right track. So omegas are a great thing for your gut. Another thing that's really good for you is, does everybody know what probiotics are? Okay. And you're going to see an advertisement for eating yogurt because there's acidophilus in that. And yeah, it's not bad, but it's nowhere sufficient to be changing your gut bacteria. And the problem is, depends on how often you've been on antibiotics over the years, that you're going to basically sometimes, when you take an antibiotic, it kills everything, the good bacteria as well. So then if you've been on repeated doses of an antibiotic, then you start setting yourself up for yeast infections, which is candida. So that's where a good probiotic, and once again, just goes back to that leaky gut concept of gut doesn't work, brain doesn't work. So there's a lot of good probiotics out there. I like the one they have here, but that's something else. You can always look at your blood work and see if it's making a difference. Okay, this next one I'm talking about is called Relax Max. And what it does is it's a formulation that a lot of times, this is for somebody that's already been having problems. Like let's say you've been abusive with drugs, alcohol, or whatever. So you've already got the condition of anxiety or something. And this supplement, what it does is it calms your brain down. So a lot of times, if you're being dependent on always drinking alcohol, you can use this to basically curb your cravings for alcohol, because it just goes back to that whole dopamine receptor thing that gets fried. So there's a supplement. It's, well, once again, it's amino acids, L-theanine, and what that does is helps to see a catecholamine is basically an excitatory stimulant. So when you can Google the word and you're gonna see that there's vitamins that have a catecholamine. It's like an excitatory effect. It's like your fight or flight reflex. And then all your drugs like cocaine and ecstasy, they also are catecholamines. They're synthetic, but they're speeding you up. And what this supplement helps to do is to slow you down, to make you not crave that anymore. So, okay. Of all the stuff I'm going to tell you that I really like the most, I'm going to say I probably like the Cogniquil, and I'll be talking about the ATP Ignite here in just a moment. The biggest thing, and your best example is always when you go to class reunions and you see the high school wrestler heavyweight is now the same size, or the guard on the basketball team is now the same size as the heavyweight wrestler. You see these every 10 years. So you see these changes, and over time, the three big C's are cancer, cardiac, and now it's cognition. Okay, so in all age groups, doesn't matter. Cancer or heart disease are number 1 and 2 causes of death. Number 3 cause of death is trauma from falls, except teenagers, because that's car accidents. And the number 6 cause of death right now is Alzheimer's. And in the last 30 years, they've tried over 200 drugs, and none of them really work. And the best study is, my dear girlfriend from Finland here, is the Finnish study came out in 2013, and what they found was if they had patients doing balance exercises, following a Mediterranean diet, which Celine's going to tell you is the best thing as well, as far as cutting back on the white stuff, cutting back on red meats, stuff like that, and then doing memory exercises, and that was the best outcome versus any kind of drug study. So the reason people are probably getting Alzheimer's at a greater rate now is a lot of times when you look at their minerals that they're taking in, they're probably zinc deficient and they're probably copper rich. And the dumbest thing in the world to do, and if you ever buy a vitamin of any sort, you don't need copper. Okay, we're already exposed to this stuff. So a very small percentage, and again, blood work would prove it whether or not you need copper. So the reason people are getting more neurodegenerative diseases, too little zinc, too much copper, and then the other thing is magnesium. Okay, and there's different types of magnesium out there. Magnesium malate is good for a lot of musculoskeletal things, but in this product here, what they do is they have a product that it's all proprietary stuff, but it's Magtine, and what it is, it's the only magnesium that's going to cross the blood-brain barrier. And so a lot of times when you're dealing with brain function, if you're not getting enough magnesium in your brain, that's right there setting yourself up for it. So this product here, if you're looking at something to take during the day, it's got a combination of, we'll be talking about B12 here in just a moment, but it's got a nice combination of just relaxing you, helping you with focus, mental focus. So that's what I love about Cogniquil.
Real quick, do you recommend this just for adults or for like teens? Or children?
I wouldn't be giving any of these things until I saw their blood work. Okay, because a lot of times too, you're talking about more than likely if you got an autistic child, or if you got any kind of special needs as far as ADHD, ADD, you want to look at their blood work first. And the biggest problem, in fact, this next thing I'm talking about here is B12, is a lot of people have a hard time methylating things properly. So you can take a cheap B12 vitamin, or same different folate, but the thing is, if it's not methylated, if you have an inability to methylate things properly, then it's not going to work. And the one thing I'm impressed with, and I'll be talking about another supplement called glutathione in a bit here, but what I'm impressed with is they've come up with formulations that rather than traditionally having to do B12 shots, okay, is you can get the same effect by taking an oral supplement.
What kind of shot?
Just B12 shots, like for example, you see it advertised all the time. And the problem is B12 is a water-soluble vitamin, so it's not really lasting that long. It's saturating the tissue, but the thing is, if you can take something orally versus having to go and get a shot, I'd want to do that. So, okay. But a lot of people know that B12 is all the B vitamins are important, but B12 is especially good for the brain's nervous system, a lot of different functions. So, okay, this is what I was talking earlier about. It's called Magtein, and several of the supplements that I'm talking about here have this in it. The Cogniquil has a little, the NeuroOptimag, the Cogniquil, and then actually the ATP Ignite have different levels of it. But the big thing is magnesium is very important. It's over 300 different metabolic functions in your body, and if you're deficient in it, your brain just doesn't work as well. The big thing too, like if let's say your blood pressure is really high, what they do is give you a shot of magnesium, slows you down. If you take too much magnesium, you're going to probably have diarrhea, so you got to find the right amount to take. You got to be careful. Everybody talks about detoxing. Okay, if you don't have your blood work done, you may be too sick to detox. If you got bad kidney and liver enzymes, and people buy this something online or they buy this multi-level thing, they end up in the ER room because it almost kills them.
I've done that, what you're talking about with Epsom salts.
Mhm.
I do that every year
Yeah.
for my gallbladder.
Yeah.
I haven't died yet.
Well, that's important. But what's not a bad deal is to, once again, make sure that you see, it's just like if you injure a joint, okay, it's going to get arthritic. If you genetically or are abusive to your body, you see your liver creates the bile salts that shifts over to the duct, through the duct work to the gallbladder, which emulsifies them into the digestive fats. And if there's too much abuse on your body, or if it's genetic, those salts become sand, and then they become rocks. And if they're big enough rocks, they're going to blow that bile duct
But
out.
they say, if you do the grapefruit, that softens.
The grapefruit detoxifies. It causes your liver to, basically kick out those things, the toxins. Here's a little side note. If we think of several hundred years ago, you got poison ivy, you got aloe vera. Okay, they both, one makes you feel good, the other one makes you itch. Okay, so this was a story for me. About 10 years ago, I was down in Florida, and one of my friends that we were with, he had the happiest and the two happiest days of your life is the day you buy a boat and the day you sell it. And so this guy's had the bright idea they bought it for deep sea fishing and do excursions with tourists, and eventually that fell apart. But anyway, so they took us out, and we were in the intercoastals, and all of a sudden I threw out a line, and I catch a barracuda. And who sees barracuda on a menu? Never see it, okay, because they're bottom feeders. And so what happens is the guy Kenny, who was the ship captain, he goes, I don't want to waste $1,000 on getting a taxidermy. He goes, we just throw it away. And so never thought of anything again. And then a couple years later, I was actually in Playa del Carmen, Mexico, and I was going to go spearfishing. And the short story was I had a burner phone for, I was actually in Cozumel, but I bought a burner phone from Playa del Carmen, so they thought I was in Playa del Carmen to be picked up rather than where I was. So I'm sitting there and waiting, and they never came. So then all of a sudden these Mexican fishermen come in, and they go, well, senor, if you buy the beer, we got the fish. So I gave one guy $20, and he gets the beer. Next thing you know, they're bringing out lobster and gray snapper, red snapper, everything, and all of a sudden they bring out a barracuda. And I'm thinking this is the part where they kill the gringo. So they would always give me the first portion of everything. And so what I do is, I was eating the fish, and all of a sudden they give me this barracuda, and it's like I'm sitting there. So I kept trying to engage conversation with everybody. And then finally, then all of a sudden they start eating it, and I go, well, if they're eating it, they must be okay. So then I asked them, and this goes back to the poison ivy thing, is once upon a time you had your taste testers for poison. So the thing is, all your toxins are stored in your liver and your muscles. So the reason that procedure works is it detoxifies your liver, but the thing is it's also storing your muscles, and I doubt any of us are going to probably eat each other tonight, unless we're in cannibalism. But what you do is when you catch that, they said this is what you do, is when you catch that fish, and one in four in Florida waters, I'm sorry, 3 in 5 in Florida waters are toxic, whereas 1 in 4 in Mexican waters are toxic. So when you catch that fish, you take the raw liver, you take a bite into it. If you get a Novocaine feeling around your lips, the fish is toxic, you throw it away. If you don't get that feeling, the fish is good. And so that's...
I lived in Africa for a few years. We were fishing barracuda and eating it all the time.
Yeah, it just depends where you're at. So, but that was just a little side note of how toxicity works. So
So
any,
you're saying you're not recommending that procedure. You're stating that,
right, well, I'm going to recommend that procedure, and I just did recommend it to a patient because she just went and had a Doppler ultrasound done. And if you have a Doppler ultrasound done and you have no, if it's not showing any large stones, you're good to go. Because the flip side is, if you let those sands turn into rocks, you can go to MD, you can have your gallbladder out. And once your gallbladder is out, you've lost a big percent of digestion for fats.
So you're saying only to do it if you've had an ultrasound? That would
Correct.
be the recommend?
Yeah,
Okay.
get a Doppler ultrasound and then you can proceed. So. Okay, and then another thing too at the very end of this slide here is there's I hope I live in South Scottsdale, and back in the late 80s Motorola poisoned the water table, so that's why there's a high rate of cancer and Lou Gehrig's disease there. But I mean, you should have a reverse osmosis system, and the problem is if you have a reverse osmosis system, it takes everything out, so you're taking out calcium and magnesium, so that's how you can become mineral deficient. So you got to replace things.
I have a question about the liver.
Mhm.
I ended up in the hospital about a year and a half ago. And I had been taking a medication my doctor prescribed, and every time I said something about it, he said, well, your liver levels are up a little bit, double up on it. So I ended up, instead of taking one a day, I was taking 4 a
This
day.
was metformin for diabetes.
Yeah, okay.
So I'm taking metformin,
Sure.
and it's a wonder drug because they just give it to everybody that's diabetic because it works for everybody. Well, there's a very low percentage of people that are allergic to it.
Lucky you.
Yeah, yeah. So I ended up in the hospital with acute cirrhosis of the liver, not due to alcoholism, and was instructed to never drink alcohol again. Okay, so I said, okay, I was in such pain, I will never touch it again. Not long after that, a month or so, I was back in the hospital with almost the same kind of pain, and they found out I had a blockage of my
Bile duct.
bile duct. Now, was that caused by anything that the liver and, I mean, I
Well-
don't have a gallbladder anymore.
How long prior to this was your gallbladder removed?
Several years.
Several years, 2 or
Okay.
3 or 4 years.
This is the thing, and when I'm going to be talking a little bit more about science-based nutrition at the end of my talk here, you can't drive a car with 3 wheels, you need 4, okay? You need a carburetor, you need an exhaust system, all these parts, there's a lot of moving parts that all work together. The problem with when your diabetes, your sugar levels, that's going to tax your liver, okay? And because it's produced in your pancreas, everything works together with the liver, and the problem is you can be a non-alcoholic liver cirrhosis by being abusive with sugar in your diet, okay? And you can be abusive with a lot of, and unfortunately the side effects of many drugs are liver toxicity, which eventually becomes a cirrhosis issue. So I'd have to see your medical file and
What can I've asked everybody, and then nobody had an answer or just ignored me. Is there something I can do to not have the bile duct
well,
blocked again?
without shooting from the hip too much, the best thing I'm going to tell you to do is consider trying the omega that's micellized, that's water soluble to reduce inflammation, And I'll be talking about something called glutathione here in a few slides that basically is going to make your liver work better again. Okay, so we're almost done here, so then we can do more question and answer. But yeah, just like I talked about, you know, reverse osmosis, you gotta, you know, look at your trace minerals and stuff to make sure you're replenishing stuff you're losing. Okay, ATP Ignite, I gave everybody a sample of that tonight. And it's basically, if you like coffee and if you're looking at a very healthy energy drink as a replacement, like a lot of these energy drinks, they have a lot of sugar, you know, and the biggest thing, you know, phenylalanine. The problem with a lot of these artificial sweeteners is they're 200 or more times more sweeter than simple sugar. So that basically, artificial sweeteners made us fat over the last 50 years. And so what the ATP Ignite is, there's a little glutathione in there, there's some different stimulants, but I have the hardest time always remembering this word, so I'm just going to make sure I say it right. It's terasiblene. Terasiblene is that one that starts with a P there. And what that is basically, it's a natural caffeine. Well, do you guys understand what half-lives are?
What is it?
Terasiblene. Okay, do you guys know what a half-life is?
I'm sorry.
A half-life. Like drugs stay in your system for a period of time, or anything stays in your system for a period of time. But the half-life of caffeine can be anywhere from like 3 to 6 hours. The half-life of this stuff the half-life of coffee caffeine is 1 to 3 hours, depending on what study you look at. This stuff is more like 3 to 6 hours, or actually 3 to 8 hours. So it's more of a sustained release, so you don't do that crash. Like a lot of times, what do people do? They stop having healthy breakfasts, they get the sugary donut and the big coffee. That's how they started off, and then they crash at 9 or 10 o'clock in the morning. The ATP Ignite is a nice drink to try for if you're trying to replace coffee and you're trying to have more of a sustained energy. And the reason I told everybody, if you didn't have a sample, take one tonight. Do not do it tonight, do it tomorrow. And if you're not sure how sensitive your body is, do half the sample. Okay, but I love coffee, and I've cut back substantially since using this product. So
All
liver
these-
crash is bad.
All these different things you're talking about, all are in that supplement or whatever?
In this one, the ATP Ignite, yeah, it's called Pure Energy. That's the patented product of it. And then you see the word, that sentence right afterwards is it's called terasiblene, which is PT. See that word there? So anyway, but it's a natural form of caffeine. So okay, this is one of my favorites because it really helped me a lot. I had a fatty liver last year, and I have a company coming in that they do the whole wellness screening on, and I was already taking injectable glutathione. Glutathione is an antioxidant for your liver, okay? And so I was already taking glutathione because I do testosterone replacement therapy. So I was taking I was of the opinion that you had to inject it, okay? And I took this oral supplement for 75 days, and last year I had a fatty liver, and it was checked in April and September, it was fatty, okay? January I started taking the supplement, April they came back, so in 75 days I reversed a fatty liver. So you can change stuff. Drugs, unfortunately, you know, what we intentionally or a doctor prescribes to us can destroy our liver, but there's a lot of things you can do nutrition supplement-wise for this as well. So they have a formulation, they have all these different patents on it, and just that's why their stuff is just so much, you know, you can have a car, and one of them can be Yugo, and the other one can be a Mercedes. They're both cars, but they're so uniquely different the way they're formulated. But the big thing is you know, putting it to the test, and that's where I'll be talking about blood work here in a minute. So, okay, and this is the thing that I asked about earlier, what a half-life is, and there's something I always like to educate people on. It's called the rule of fours, and what it means is, if let's say you didn't have oxygen to your brain for 4 minutes, you're a drowning victim, you're being choked out, you're dead. Okay, if let's say you didn't drink water or fluid for 4 days, you'd probably be dead. And if let's say somebody sticks you in the desert for 40 days, you'd be dead. Okay, so half-lives are seconds, minutes, days, weeks, months. And you know, everybody's up about vitamin D. Okay, well your vitamin D half-life is 15 days. and you can get your vitamin D level checked, and it's called it's deciliters or nanoliters. And ideally, you want to see your vitamin D level. You know, medical 30 is okay to them, but vitamin D levels ideally should be 50 to 70. And so if you get your blood work tested, and again, you know what Mark needs for a vitamin D supplement, if it's in international units, it's fat, it's IUs. So I may need 5,000 international units, you may need 1,000, you may need 10,000. And it's just kind of like, you know, who here takes a piece of duct tape and puts it over their speedometer of their car? Nobody. Okay, that speedometer tells you that when you're driving down the road, you got to be between 40 and 55 or whatever your speeding ticket. So that's the whole thing. The whole thing about blood work, and we're all over 40 here. So the thing is, you should be doing your blood work yearly, and then there's techniques that I can tell you how to monitor, because the big things you're trying to prevent is the 3 C's. Okay, cancer, cardiac, cognition, and you don't. It's just like being a smoker. You don't get lung cancer from one cigarette. It's the abuse on your body over years. So if you're trying to stop that abuse and be in a more positive direction, then that's where this comes from. So, okay, so that's the rule of 4s. Half-lives is, we just talked about, it's seconds, minutes, days, weeks, months. And the last thing I'm going to talk about here, okay, is I gave you all a handout, and there's actually 4 things to it. If you are interested, and I have a company, just like what Susan does, is she brings in different businesses here. I try to bring in different things in my practice because I know I'm not everything. And I bring in like hypnotherapists, I bring in a memory expert, and what I always bring in twice a year is called Cathedral Health. And what they do is for $179, diagnose a Doppler ultrasound is not radiation. It's basically, you can look at an organ. They're going to do your carotids. They can do your descent abdominal aorta. The big thing is they look at all your organs. So do you have any cysts in your thyroid, your liver, your pancreas, your gallbladder? And then they also, there's 11 tests, and then one thing to do is a peripheral vascular resistance, where they put blood pressure cuffs on all 4 limbs. And you get all 11 of those tests. It's wellness. Okay, it's not billable to insurance, but it's wellness, and it's $179. And I just was dealing with, I farm out all my insurance, my x-rays to either Scottsdale Medical Imaging or Simon Med. And we just had a problem with Medicare being billed. So then now they used to be able to bill directly for me, and now they're not. So all my Medicare patients, either they have to go back and see their primary to get a referral, or it's cash price. And so then I have cash pricing for the x-rays. And I just asked them, so what's the cash price for a Doppler ultrasound of your carotids? $224 just for that one test. You're getting 11 tests for $179. It's dirt cheap. And again, if you're questioning yourself, okay, what you're doing hasn't killed you. Okay, but let's say if you did a big stone the next person, you could end up in the ER room and be in a lot of trouble. So that's why, I'd never let anybody do that detox like I talked about seeing that.
Can you do anything about it, like carotid artery? Can anything be done without it?
Yeah, there's a lot of different, well, yes and no, because there's something called DMSA, and what it was is it's a chelation that you can help, and unfortunately there were some doctors that killed people the last couple of years, so it was outlawed. You can only get DMSA through Canada now.
Don't get one.
Yeah, but the thing is, you can, this is not my scope of practice because I don't write scripts, okay? But the thing is, if you look at your blood work and you reduce inflammation, you may help to naturally chelate. See, what chelation therapy was is back in World War II, sailors were exposed to a lot of lead-based paint, and what they found with chelation is it demineralized, got the lead out of their body, and at the same time it also helped to get rid of plaquing. So that's why chelation came around in the first place. If you really want to do it right, you'd probably have to go see an MD, functional medicine doctor, or a naturopath to do chelations sessions on it.
I've been to at least 10 this year.
Really? Okay. Sorry to hear that.
No, every kind. I went to the Muhammad Ali Center for Neurology. They couldn't. They told me I had to go to an allergist.
For the carotid?
No.
For
the
muscle.
vertigo.
Oh, okay. I see a lot of vertigo.
That's what
I had it for 8 months.
No, that's my specialist, movement disorders and vertigo, so we can talk later. So, okay, so I was talking about the cathedral health thing. My approach is science-based nutrition, and I'm always trying to help people save money where they can. But the approach is, let me see your blood work, okay? And there's, I think this is the first sheet. Let me just borrow yours for a second. So the first one here you're seeing, there's basically 48 tests on this. You can just give me one.
Make sure I don't throw my pen.
Okay, so it's just like I said before about, you need 4 tires, not 3 to run a car. So this is about, there's 58 tests here, and this is all cash pricing. And the thing is, if you got good insurance, use your insurance, okay? Because if you look then in the 3rd page, what I've done is I've given you all the codes for either LabCorp or Sonora and Quest to complete these tests, okay? Now the problem is, it depends what your insurance is like. If you've got a PPO plan, then a lot of times this billable to insurance, and a lot of times too, if you're over 40, you should do your hormones, you're gonna be ballpark $1,500, okay? And if you got great insurance,